So I'm still calling it afternoon. Good afternoon, committee. With that, I think we can go ahead and come out of recess. We do have a couple members that are missing. The Senate floor just went in. So as we move through what we have here today, if there's issues, we'll figure out the presentation issues. So let me figure out where we are, and we'll go from there. This is this. All right, so with that, we don't have Dr. Hardy, but I know we've got Dr. Titus here. So we will go ahead and open up the hearing on SB 233.
Madam Chair and members of the Assembly Ways and Means Committee, thank you very much for being willing to hear SB 233. I'm Dr. Robin Titus, Assemblywoman from District 38, and Senate Bill 233 was a bill that Senator Hardy and I co-sponsored, and it basically asks for monies to the Nevada Health Service Corps, an already established institution. I'm sure that it comes to no surprise to any of you that Nevada ranks at the bottom or near bottom of most healthcare rankings. One is provider ratios to patients, especially prominent in rural areas, but also urban underserved areas. This bill offers a solution. I'm here to testify that financial assistance with requirements works. I want to briefly share my story. I grew up in Smith Valley. My family was very poor. My father made $3,000 the year I graduated from high school. They furnished a lot of love, but no financial assistance. I made it through undergraduate school on scholarships and literally 3 jobs. After I was accepted into medical school in 1977, so I'm dating myself a little bit there, I kept working night jobs the first year. But when I started my clinical rotations, that ended. I needed to either borrow money or join the military. Family practice in a small town is one of the lowest paying medical practices. A large financial debt would not have allowed me to return to my beloved Smith Valley. I came up with an idea, and I reached out to my county commissioners. They agreed to pay my tuition and some living expenses for the 3 years I had remaining in medical school. In return, I was required to practice in rural Nevada for 3 years. I practiced for over 37 years. I now have in my office 2 local graduates, one from Garnerville, a medical doctor, a graduate from UNR Medical School, and a physician assistant from Yerington. Both of these folks have received money from this program. So with that, hopefully Gerald Ackerman is on the call. If not, I know that we had exhibits to where this program went and where the money has been spent. If he's not able to be called up, I can give a brief overview, Madam Chair.
And thank you, Dr. Titus, and we didn't say this at the beginning, but we're going to go ahead and open up the hearing on SB 233, so that's fine. We've now done that. So I guess my question is, so this currently exists. How much is in their budget currently?
So again, that would be a financial number, and I think, you want to come up? Can Joan Hall come up
Sure. Ms.
as
Hall?
call a friend here? Literally phone a friend. We've worked many years together.
So I'm just curious if this is base funding, if this is in addition to the base funding that's already been included in the budget. What are the total dollar numbers available here?
Last session, Joan Hall, for the record, representing Nevada Rural Hospital Partners. Last session, this body authorized $500,000, excuse me, and that was matched federally, dollar for dollar. This year, it would be the same. The federal government has told us they will match dollar for dollar.
Okay, thank you.
And all of that money is always expended during that 2-year period.
Okay, thank you. So Dr. Titus, if you want to go ahead and proceed.
Yes, thank you. Thank you, Madam Chair. So right now, currently, folks that have received this reimbursement and returning to Nevada, we have 58 different medical professions, from physicians and other healthcare professionals in 13 counties that have received support from this program. So this is truly one that works. In Clark County, I'm going to point out we have one dentist, 2 medical doctors, 1 PA, 1 pharmacist, and 2 psychologists who are currently practicing in Clark County, and they had reimbursement from this fund. In Lincoln County, we have a nurse practitioner, 2 physician assistants, 3 nurses that have this fund. White Pine County, 1 licensed social worker, a nurse practitioner, a PA, 2 pharmacists. In Elko, we have 2 dentists, 1 medical doctor, and 5 PAs. In Eureka, a nurse practitioner. Lander, a nurse practitioner. Humboldt, a medical doctor. Pershing, a nurse practitioner, PA. A DO, a medical doctor. In Churchill County, Washoe, also 4 pharmacists. In Washoe, a licensed social worker, a DO. Lyon County, as I mentioned, multiple nurse practitioners, the PAs, nurses. Carson, pharmacist, and Douglas. So throughout this state, the state has benefited from this program.
And if I could ask Dr. Titus, so are these strictly for practitioners through the UNR School of Medicine, or is this students at UNLV and UNR?
Actually, Madam Chair, if I might, Robin Titus, for the record, these folks have come and had training from multiple locations. This is to offset their debt to come to Nevada.
So this isn't just for Nevadans then, we're giving this money to people from outside of Nevada, even though we've got 2 medical schools here.
Right, exactly, and we will give it to them if they stay. But the problem is, we know, as you know, our folks don't stay with the training, right? And so frequently in many of these schools, we don't have. So that's why we expanded this, because as we've developed the medical schools, we don't need it to reimburse. So initially, the pharmacists weren't in there. Initially, the social workers weren't in there. But as we've seen that, who do we need to, and what positions do we need, we've expanded who we give this money to so we can fill these very healthcare shortage areas, which we voted on earlier, to document exactly what are our healthcare shortages, what should we be reimbursing for these folks to come either back to Nevada, and certainly that would be a priority to bring a Nevadan back, because many of our students, all of them, the med students that want, all the students from Nevada who want to go to medical school, there's not room for everybody, especially PA schools. As we've developed and expanded our PA programs, these folks haven't been able to get into pharmacist programs. They don't get that here. So to get these kids back is one priority, but then there's other areas of need.
And this doesn't address nursing at all?
Oh, no, as I stated, we have nurse practitioners who've returned.
Okay.
As a matter of fact, there's been more nursing, I think, as a record of anything.
Okay.
And nurse practitioners and RNs, not quite at the level of nurse practitioners. So it's the whole gamut of providers, and that's what we realize. We don't just have a healthcare shortage of physicians. We have a healthcare shortage of providers across the spectrum.
Okay, so with that, committee members, any questions of Dr. Titus? Ms. Miller?
Thank you, Chair, and thank you, Dr. Titus, for bringing this. I totally support this type of legislation where we support students in our most needed professions to work down these student loans, but I'm going to ask you the same question that I asked yesterday. And I will preface it with saying, is it already in legislation, the requirement that we have for service for students of how many years of service is required of them for this support? And also, if you could just briefly throw out an average of what's the average number that each student may get. I know it would be different per profession. Obviously, an MD is different than, but if you could just throw that average out.
This is Joan Hall, Nevada Rural Hospital Partners, for the record. The Nevada Health Service Corps is has their own set of bylaws that they follow, and that is the Office of Rural Health through the UNR School of Medicine is who does this program. Typically, it's $50,000 per provider for a 2-year commitment to work in a rural underserved area. And then there can be continuation contracts for $25,000 per 1-year commitment.
Thank you.
And if I might add, Robin Titus, for the record, if they negate that, if they fail, they have to pay it back. there's penalties. So if they decide they take a job, they leave the state. So this is the one true thing that we bring folks, it helps our students who have to go out to come back. Positions that we can't find spots for of our students, we fill. And it keeps them there for the 2 years. And if they renege, there's obligations. So this is entirely spent every year. We actually could put a lot more in it, but as our chair notes, there's only a limit to this. But this was one. You hear me say it, and frequently you prefer that I not say it, that something that we do may or may not help healthcare. This is one that, without question and documentation, this money only gets spent if that provider comes to the state.
And they only need to stay here for 3 years. Is that correct?
Joan Hall, for
however
the
long it
record,
takes to repay it?
it's a 2-year commitment initially that they have to commit to, and then after that, there can be 1-year continual commitments. And I just might add that since the inception in 1989 of this program, I believe there are only 2 times that a provider has not stayed in that community. One time it was a personal issue, and the State Office of Rural Health actually found another underserved community for them. And one time there was somebody who had to pay it back. And that was out of, I think there has been 204 loans given out since the inception.
Okay, so with that, I have a question from Ms. Monroe Moreno. She just got that, so I'll go to Mr. Levitt, and then I'll go to Ms. Howdigy.
Thank you, Madam Chair. So does this program actively recruit doctors to the state or healthcare professionals to the state, because it's not just doctors? So how do you go about getting them here, or do they come to you? Do you have a list of Nevadans who went out of state or are in state that you think would be willing to practice here?
Joan Hall, for the record. The Office of Rural Health is also involved in a national recruitment product called 3RNet. So Keith Clark, who runs this, actually knows of those individuals who are looking to come to another area. And this loan repayment is a national program across the United States. They're aware that Nevada offers this. And so it's a recruitment tool for CEOs.
Thank you, Madam Chair. And I just want to go back to the repayment for those who don't fulfill their commitment. So is it on a sliding scale? Say someone receives the $50,000 and they stay a year and then they leave. Do they only have to pay back half of that portion, or do they have to pay back the entire portion? And does that money stay with the Nevada Health Service Corps, or does it revert back to the state and the general fund?
Joan Hall, for the record, it is on a sliding scale based on how long you actually fulfilled your obligation, and it goes back into the Nevada Rural Health Service Corps. Again, that's only happened once.
So if the money that's repaid goes back in, how much is in there now that's been repaid? So this is in addition to current dollars that you have. So I guess I'm a little confused.
Sorry, this is Joan Hall, if I confused you. It only goes back to the system if the person doesn't make their obligation.
Okay.
Otherwise, it is tax-free to the individual, and it pays off their student loans. And it looks like Gerald Ackerman has joined us now.
Okay. I just wanted to make sure that we understood that correctly. I'm always trying to figure out how much is there now, how much more are we adding, where are we at, because things change over time.
Madam Chair, if I might, with the questions on where the funds are, if we could have Gerald just kind of clarify that, what's there and the ones they spend. I had his letter here, but I think I know we are pressed for time and it's late in the 120 days, but I think that the concern, because this is the fiscal committee, about how these funds, if any, are left there. And Mr. Ackerman, the question was whether there is any residual funds. Where does that go? And it's our understanding that all these funds are spent, and that only one time there was a renege, and it would go back in the program. And again, these are federally matching. And if it's okay with the chair, would Mr. Ackerman be able to? If you need more details, if you're fine with it, we're good to go.
Okay. I Believe so. So are there any other questions at this time? Mr. Ackerman, did you have anything you would like to add at this time?
No, Madam Chair, just thank you for the support and the ability to be able to present this. And all funds have been expended. Through the last legislative session, about 58 additional people received loan repayment around the state. And we would have no thought that we wouldn't be able to do that again. So thank you very much. It makes a big impact on rural and underserved urban parts of Nevada.
Okay.
Thank you.
Thank you very much. With that, any other questions from any other committee members at this time? Ms. Howdigy?
Thank you. And just one, because I want to see how successful this program actually is. So there was 204 loans that were paid off with commitments to stay here at least 2 years. 1 or 2 of them actually reneged. How many of those stayed past their 2 years and have stayed in Nevada permanently?
We at one point in time had, this is Gerald Ackerman. We at one time had done a study. We were at about 70 to 80% of those people staying in Nevada. Have not done one on the 58 because they are currently under obligation. The 204 before, it was about 70%, 70 to 80% had stayed in Nevada. That answers your question.
Okay, I think we're good there. So with that, I need to take care of something. I am going to turn the support, opposition, and neutral over to the vice chair for a moment, if I may. Thank you, Vice Chair, for your flexibility. Appreciate it. And then if I am not back, I believe we can just, we need to get to the foster care ones. We would prioritize SB 366 as the next bill to be heard after this one if I'm not back. You sure can. Take this folder. There you go. And I will be right back. Thank you all very much.
Thank you, Madam Chair. Members, do you have any other questions for the presenters? All right, seeing none, then we will go to testimony in support of Senate Bill 233. Do we have anyone here in the, go ahead.
Can
you're
I
already
be
at
in
the
support
table.
and
Yes,
the
you
presenter?
can.
Thank
Yes,
you.
can.
Thank you, Madam Vice Chair. Joan Hall, Nevada Rural Hospital Partners, for the record. Just, this is a very important recruitment and retention tool for not only rural areas, but underserved areas specifically. One part I don't think that was said is that you have to have a HPSA score to even be able to be eligible for this. And a HPSA score is a national scoring system where the federal government does this, looking at the number of healthcare providers per population, infant mortality rates, prevalence of poverty in the population, number of elderly in the population, and prevalence of health disparities in minority populations. So you get a score, a national score, from 1 to 25. The higher the number, the poorer you are, the higher your HPSA score is. So just wanted to put that on the record. And we thank you for your consideration of this.
Thank you so much. Do we have anyone else here in the room with us that would like to provide testimony in support of Senate Bill 233? Seeing none, do we have anyone joining us by Zoom who would like to provide testimony in support of Senate Bill 233? Seeing none, do we have anyone joining us by telephone? Broadcast staff, do we have anyone on the telephone who would like to provide testimony in support?
Pardon me, here I am. If you would like to provide testimony in support of SB 233, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 655. Pardon me, 653. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good evening, Madam Vice Chair and the Astute Committee of Ways and Means. Thank you to Dr. Titus. This is Dora Martinez. We do support this bill, SB 233.
Thank you so much, Ms. Martinez. Next caller?
Chair, there are no more callers in support. I may have inadvertently hit mute on that last caller. Can I have her make sure she was finished?
Yes, thank you. I'd appreciate that.
Thank you. My apologies. Please continue, caller
This
653.
is Dora Martinez. Oh, thank you so much, Mr. Broadcaster. I was finished. Thank you. Have a good evening.
Thank you, Ms. Martinez. It's so nice to hear your voice, and I so appreciate your advocacy and involvement in every committee during this legislative process. We truly appreciate you. So, broadcast, are there any other callers? I believe you said you had no other callers on the line. Is that correct for testimony and support?
Yes, Vice Chair, that was the last caller in support.
Perfect. Then we'll move to opposition. Is there anyone here in the room that would like to provide testimony in opposition of Senate Bill 233? Seeing none, do we have anyone joining us by Zoom who would like to provide testimony in the opposition? Seeing none, do we have anyone on the telephone lines who would like to provide testimony in opposition?
If you would like to testify in opposition to Senate Bill 233, please press star 9 now to take your place in the queue. Vice Chair, we have no callers in opposition on the line.
Thank you. And with that, we'll move on to neutral. Seeing no one here in the room coming to the table to provide neutral testimony, do we have anyone joining us by Zoom who would like to provide neutral testimony on Senate Bill 233? Seeing none, do we have anyone joining us by telephone to provide testimony in the neutral position on Senate Bill 233?
If you would like to testify in neutral on Senate Bill 233, please press star 9 now to take your place in the queue. Vice Chair, we have no callers in neutral.
Thank you so much. And with that, we'll close the testimony, but I'll ask the presenter if she has any closing comments.
Thank you, Madam Chair. Just as you can tell my enthusiasm for this program, because I think it does very good things, but I just want to point out that this program was established by this body in 1989 and has continued to fill this program with matching federal dollars. It is has been one shown to bring folks healthcare to Nevada, not just in rural areas, but underserved urban areas, and I would appreciate the continual support that this body started in 1989. Thank you.
Thank you so much for that. And with that, we will close the hearing on Senate Bill 233. And with the chair back, I will turn the gavel back over to our chair.
Forgot my microphone this time. So then we will open up the hearing on SB 366 relating to juvenile justice. And who do we have available to have conversations about this bill? Mr. Ortiz, are you pinch hitting? Oh, and who do we have on Zoom?
Bridget Duffy.
Hello,
I'm
Ms.
on
Duffy.
Zoom.
Nice to see you. If you would like to go ahead and proceed,
Great to
please.
see you too. Good evening, Chair Carlton and members of the Assembly Ways and Means Committee. Been waiting since 11 o'clock last night to get to this point. I am Bridget Duffy, BRIGID, DUFFY, Chief of the Juvenile Division for the Clark County District Attorney's Office. I am here without Senator Orenshaw, who I believe is still on the Senate floor, had to leave for the Senate floor, so I'm going to take over as best I can to present SB 366. I want to thank the members of the Interim Committee on Child Welfare and Juvenile Justice for bringing forth SB 366. I will not be the person to address any fiscal notes that may be attached. However, I can give you a quick general overview for the basis of the bill. I'm going to stick with Assemblywoman Carlton, Chair Carlton's earlier comments and just keep it brief. If you need a in-depth juvenile justice class, I will help you do that. Otherwise,
Another day for that
I'm gonna
would
tell
be
you
much
real quick.
better, thank you.
That's right. We're going to do this quick. So when an adult commits a crime and is determined to be a danger to the community, Nevada has a process in place to safely house the adult while making efforts to restore him or her to competency. We have no similar system in place for juveniles. So if this juvenile is 15 years of age or under and is alleged to have committed a murder and is deemed to not be competent, either due to mental illness or developmental delay, we have no safe, appropriate housing for the juvenile while he or she obtains treatment. In my experience, there is no greater risk to the community or to the child, him or herself, than a child who is deemed to be incompetent and has a propensity to pick up a firearm. SB 366 is a step forward to addressing the void in our system in an effort to treat children in appropriate settings and ensure that victims obtain closure in their cases. Closure that is more than a prosecutor telling a victim's family, I'm sorry you lost a child. There's nothing in the system that we can do to provide housing or treatment or services for the child who took your child's life. So again, I'm going to follow the directions of the chair and just be available for questions. I have DCFS. I see Ms. Miller on the call for any of the fiscal concerns, and I'd be happy to take any questions you have, and I appreciate the opportunity to present SB 366 today.
All right, is there anyone else wishing to make a comment at this time on Zoom? Not seeing anyone wishing to be recognized because we don't have a member of the Senate here at this time. I'll go ahead and I'll have Ms. Kaufman walk through the fiscal impact note. This is at the bottom of our notes, and we can proceed from there.
Thank you, Madam Chair. The Division of Child and Family Services has identified a fiscal impact of $50,000 to complete a study to determine the specific needs and treatment of youth, to assure proper resources to provide safe and effective care for youth who is identified. The division indicates that federal system of care funds would be used to cover the costs associated with the study, and so no general funds would be needed at this time.
Okay, thank you very much. That answers one of the biggest questions of the evening for that. So, committee members, are there any questions of Ms. Duffy at this time? Not seeing any, and the fiscal note has been removed, so this is the hearing for SB 366. We will go ahead and open it up. Is there anyone in the room here in support of SB 366? Seeing none. Anyone on Zoom? Seeing none. Anyone on the phone line?
If you would like to testify in support on Senate Bill 366, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 377, please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Good afternoon. My name is Deshaun Jackson, DASHUNJACKSON. I serve as the Director of Children's Safety and Welfare Policy with the Children's Advocacy Alliance, and we stand in support of Senate Bill 366. Thank you so much.
And thank you very much. Next caller, please.
Chair, that was our last caller on line in support.
Thank you very much. Is there any opposition in the room? Seeing no one come forward, is there any opposition on Zoom? Seeing no one wanting to be recognized, is there any opposition on the phone line?
If you would like to testify in opposition to Senate Bill 366, please press star 9 now to take your place in the queue. Chair, we have no callers on the line in opposition.
Thank you very much. Is there anyone in the room in neutral? Seeing none. Anyone on Zoom? Seeing none. Anyone on the phone line, please?
If you would like to testify in neutral on Senate Bill 366, please press star 9 now to take your place in the queue. Chair, we have no one on the line to testify in neutral.
Thank you very much. So with that, committee members, I don't believe there's any other questions at this time. We will go ahead and close the hearing on SB 366. And we'll go to SB 397. Good afternoon.
Good afternoon, Madam Chair. Joanna Jacob from Clark County. I am pinch hitting for Senator Orenshaw. Unfortunately, he is on the floor. But on behalf of Clark County, I, along with Ms. Bordelin, worked with Senator Orenshaw on this bill, and we can speak to the progress that we made on this bill, why it's coming to you with the amendment that it came from Senate Finance, and hopefully we have Ms. Dave. Oh, I see Ms. Roos is on the phone, who can speak to the fiscal note that was on this bill. And that's how we will proceed, Madam Chair, if that's okay with you.
That's fine. We have to go with the flow when we get to this stage of the game. So
Yes, ma'am.
whoever's next.
Yes,
please
ma'am.
proceed.
So Joanna Jacob for Clark County. We just briefly stated Senate Bill 397 in its amended form coming out of the Senate Finance Committee provides for a kind of a pathway and a roadway to make an extended foster care program. And we are calling it the Extended Youth Support Program under the amended language in the bill. It provides a pathway to extend foster care from age 18 to age 21. This is the way that the federal laws on child welfare are trending and going. And it's actually a request that has been before you for the members who were in the legislature in 2019. There was a bill, AB 150, that asked the state to do a study on how we could do this program and how we could make this decision for the state. That bill came to Senator Orenshaw because it was an interim committee report through the interim committee on the Legislative Committee on Child Welfare and Juvenile Justice. The recommendation that came out of that committee, and you'll see in the initial fiscal notes, Madam Chair, was a recommendation that we do two programs. We were supposed to do a pilot program, two separate programs really. One that would be under the federal 4E program, and then one that would be the Step Up program, which is something that Clark County partners with Legal Aid on in the South. It is a extended court oversight program that Ms. Bordelin can definitely speak to if nobody is familiar with it. But that was not the best option for Clark County, for Washoe County, or for the state, because the Step Up program is 100% general fund funded for the state, 100% general fund funded for Clark County and for Washoe County. I don't want to speak for them, but we've been working on this bill for a while. So when we worked together in the Senate to come up with a fourth option, which was to take the Step Up program that is currently in statute, has been in statute since actually under the leadership of Speaker Buckley and Assemblywoman Mastroluca in sessions past, to try and change that program to make it 4E reimbursable, so that we are not choosing one program over the other, but we're moving our program so that it can evolve and be ready for that decision when the state is able to do so, to apply to the Federal Children's Bureau to extend foster care. Obviously, this was not the session to ask for significant general fund contributions or additions from the state. That was the original state fiscal note that Ms. Roos can speak to. We also had a Clark County fiscal note that was really associated with having to run two programs, which would have been a significant impact to Clark County. With this amendment that we negotiated in Senate Finance, we are going to continue to work together with the state and the child welfare agencies to prepare a budget amendment for the next forthcoming legislative session to make this decision. That'll be in collaboration with child welfare experts, so including legal aid and stakeholders, obviously, from nonprofit agencies like the Children's Advocacy Alliance that supports this change. And then we will be able to come to the next session. But it was important for us to also put the statutory changes in place, Madam Chair. We put a lot of work into that, so we would be ready to have those statute changes in place so that we could draw down the $4E. With the amendment, it removes our Clark County fiscal note. And because we've moved the effective date out to January 1st, 2024, you will see that at the end of the second reprint I think we are on right now. And that removed our fiscal note, obviously, for the forthcoming biennium. We do very much want to see this change go into place, though, because there are federal dollars that are associated with extending this decision to have foster care it be extended from age 18 to 21. I think especially during the pandemic, there was a feeling that we wanted to provide supports for this very vulnerable population as we were struggling with the pandemic and the impacts of the pandemic. So, and we supported this actually with the amendment because we have our youth who feel like they may, when they exited the foster care system, thought that they could go out on their own and then realize that they may need some additional support and guidance as they navigate those years from age 18 to 21. It's very critical in critical years, really, that you sometimes do need a helping hand to get started. So that's why we are in support, obviously, again, with the amendment, taking it out to a January 1st, 2024 effective date. That would be so that we could go through the next budget session, I guess, and then the January 1st date was requested by the state to allow them time to apply to the Children's Bureau for the application to bring us in line with the federal dollars. So I hope that, I don't want to walk through the changes. I will say the changes were necessary for 4E reimbursement because there are some different guidelines on how the court jurisdiction is in place. And so we worked with the federal Children's Bureau on these changes so that we could get that input during this session, Madam Chair. And I will, I guess, pass it on to Ms. Bordelin, or I see Ms. Roos is also on the phone.
Okay, I'll go to Ms. Bordelin next and then.
Thank you. Bailey Bordelin, for the record, representing the Nevada Coalition of Legal Service Providers. Thank you all for having me here tonight. Nowhere I'd rather be. So to summarize that, I've never presented a bill on signing days. This is exciting.
It's not all it's cracked up to be.
It's a good way to go out, okay? To summarize that very quickly, Nevada did something before there was ever a federal program, and we created a program to allow kids who age out of the foster care system when they turn 18 to have additional support system so that they weren't just exiting the system at 18 with no family and no one to help them continue on. So that's a really successful program and something that we're very proud of as a child welfare system. And as Ms. Jacob mentioned, we work with a program called Step Up at Social Services in Clark County for that. And it's a truly life-changing system that helps these kids transition and navigate how to become an adult when they do age out of the system without a family. The government and the system continues to be that family for them. What we've done here in this bill is we've found a way to make that program and the success that we're having with it become eligible for some federal reimbursement. Because since we created that general fund program, there has become an opportunity to receive federal funding for those types of programs. So you have a labor of love in terms of statute that has some safeguards that we think are really important to protect the system and the processes that we have in place. But ultimately, it will allow us to draw down federal dollars. And then it also makes some really important improvements that we're able to make as we look at what the best path forward is. And so the biggest of those, I would say, is right now, when you turn 18, you have a choice to opt into this program for support system. And if you say no, that's kind of it. You walked away. And a lot of kids that age out of the foster care system think like, oh man, I just want to get so far away from this. And they say no. And And they may change their mind when they get out there in the real world and they don't have an opportunity to come back. Or if after 6 months they get frustrated and they walk away, they don't have an opportunity to come back. So a really great change inside of this bill is that throughout that time between 18 and 21, these young adults will be able to come back over and over again until they turn 21, even if they've walked away. So the same way that we can get in fights with our parents and still come back for help, I think it's really important that we're setting up that structure to offer more support in this bill. So we're excited about the progress that is being made there, and putting this into statute now with that pushed out effective date will allow us as a system to prepare and to work with the federal government on how we transition to that program.
Okay, so with that, committee members, any questions from the committee for Ms. Bordelon? Seeing none. Ms. Roos, if you'd like to go ahead and go. Did you have a statement you'd like to make?
Good evening. Good evening, Catherine Roos, Deputy Administrator for the Division of Child and Family Services. I do just want to put on the record that with the second reprint, DCFS will be removing the fiscal note. This is really important legislation to support this population, and we just appreciate all of the stakeholders working really tirelessly on this bill to move it forward.
Okay. So with that, committee members, any other questions at this time? No, not seeing any questions. So with that, this is the hearing. We'll go ahead and open it up. So I just want to make sure they're all beginning to blend together. So with that, we're going to go ahead and open up support, opposition, and neutral for SB 397. Those in support, please.
Madam Chair, Joanna Jacob, Clark County, just to make sure, I wanted to put this on the record that we are in support of this legislation as amended, and echo the comments of Ms. Roos. So it is a labor of love, and it's something that our youth actually have asked for, and that's why we are in support. Thank you.
Okay, thank you very much. So with that, anyone else in the room in support? Seeing none. Anyone on Zoom? Seeing none. Anyone on the phone line in support?
If you would like to testify in support on Senate Bill 397, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 377, please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Good afternoon again. My name is Deshaun Jackson, DASHUN-JACKSON. I serve as the Director of Children's Safety and Welfare Policy with the Children's Advocacy Alliance and as an alumni of the Nevada foster care system. On behalf of the Children's Advocacy Alliance, we support the amended SB 397. We believe that this bill is essential to ensuring that youth that are transitioning out of the foster care system have the support that they need. Thank you so much.
Okay, thank you very much. Anyone else on the phone line in support?
Caller with the last 3 digits, 653, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good evening, Madam Chair Carlton and Vice Chair and the rest of the Ways and Means Committee. This is Dora Martinez, DoraMartinez. I feel like you already know my name. I'm here with the Nevada Disability Peer Action Coalition, and we wholeheartedly support this common sense home run SB 397. Thank you so much. Have a good evening.
Okay, thank you very much. The next caller, please.
Chair, that was our last caller on the line in support.
All right, with that, we'll go to opposition. Any opposition in the room? Seeing none, no opposition on Zoom. Any opposition on the phone line?
If you would like to testify in opposition to Senate Bill 397, please press star 9 now to take your place in the queue. Chair, we have no callers on the line in opposition.
Okay. We'll go to neutral. Is there anyone in neutral in the room? Seeing none, no one in neutral on Zoom. Anyone in neutral on the phone line?
If you would like to testify in neutral on SB 397, please press *9 now to take your place in the queue. Chair, we have no one on the line to testify in neutral.
All right, thank you very much. I don't believe any closing comments would be needed. So we'll go ahead and close the hearing on SB 397. Right, with that, I think we want to make sure we can get through all of these, so we will open up the hearing on SB 267. Do we have anyone available to testify on SB 267? Unfortunately, the Senate is in. Our timing today hasn't been quite what we would have liked it to be. I'm not seeing if folks are listening out there in the lobby room or wherever they are watching on their iPads, if there is someone who's interested in coming to Ways and Means and talking about SB 267, we're going to give you a minute to show up. Right, so folks, we're going to not go down with that. We're not going to be able to have anyone here for that. So I think what we'll do is we'll go ahead and address SB 356. We know it's difficult for folks to get to committee meetings right now. So we'll go ahead and open up the hearing on SB 356. Welcome, Ms. Wilborn.
Thank you, Madam Chair, members of the committee. I will be as brief as possible. I also believe that we have Ross Armstrong from the Division of Child and Family Services on the line who could speak to the fiscal aspects of this bill. I know we don't have a lot of time to go into the policy, so I'll just make 3 brief points. This is a continuation of a lot of work around youthful offenders. When we use that term, we're talking about those young people who are transferred into the adult system. We've talked a lot about this with other bills that have made their way to this committee. What this does specifically during the last interim, the Child Welfare and Juvenile Justice Committee passed several different recommendations to this body, and this is one of those bills. And they studied this issue, but now it's going to revert the study over to the stakeholders who will have impact and be able to best design the types of programming and housing structures for these types of populations. And we're addressing both young people, those under 18, and also those between the ages of 18 and 25. And the purpose of that is that, from juvenile brain science, we know that young people are both psychologically and constitutionally different than adults. And so for those reasons, we are diving into this issue, and we will study this issue and bring stakeholders in to figure out the best way to handle housing these populations. So with that, I will have Mr. Armstrong talk about the fiscal aspects. Thank you.
Thank you very much, Mr. Armstrong.
Thank you, Madam Chair, members of the committee. Ross Armstrong, Administrator for the Division of Child and Family Services. There's a fiscal note on the bill to conduct the study. As Holly mentioned, this is similar to studies we've done in the past, a little bit different in expanding that age range out because it requires both the Division of Child and Family Services and the Department of Corrections to work together on the study. The two agencies came together and determined that DCFS would submit the fiscal note for the entirety of the study. So the amount in the fiscal note represents the total fiscal need. The amount in the fiscal note from DCFS represents the total fiscal need to execute this bill. With that, I'm happy to answer any questions.
Thank you very much. Committee members, are there any questions of Mr. Armstrong? It's a program that we've seen a couple of times, we're familiar with. So with that, not seeing any questions, I believe we can go ahead and move forward then. This is the hearing for SB 356. We'll open it up for support. Is there any support in the room? Not seeing, oh, good morning. Mr. Watts is in just the right spot. I didn't see you. Nope, Mr. Watts, go to the left. You go left, so that works for you, left. Thank you. Oh, perfect, there we go.
Thank you. I guess good evening. Tanya Brown, Advocates for the Inmates and the Innocent. We support this bill, and we would just like to, or I would just like to echo Ms. Welborn's comments. Make it brief. Thank you very much.
Thank you. With that, anyone else in the room in support? Not seeing anyone else in the room in support. Anyone on Zoom? Seeing no one on Zoom. Anyone in the phone line on support, please?
If you would like to testify in support on SB 356, please press star 9 now to take your place in the queue. Chair, we have no callers on the line to testify in support.
Thank you very much, and who's ever controlling my microphone, thank you also. So with that, we will go to opposition. Is there anyone in the room in opposition? Seeing none. Anyone on Zoom? Seeing none. Anyone on the phone line in opposition?
If you would like to testify in opposition to SB 356, please press star 9 now to take your place in the queue. Chair, we have no one on the line to testify in opposition.
Thank you very much. So with that, we can move to neutral. Is there any in the room in neutral? Seeing none. Anyone on Zoom? None. Broadcast services, anyone on the phone line in neutral?
If you would like to testify in neutral on SB 356, please press star 9 now to take your place in the queue. Chair, we have no callers in neutral at this time.
Okay, with that, are there any closing comments, Ms. Welborn? Nope, no, thank you very much. We appreciate that. So with that, we will close the hearing on SB 356. So committee members, we're going to go ahead and open up the hearing on SB 267. Assemblywoman Peters has graciously volunteered to step in and help us walk through this bill. We know the Senate is doing their business right now, and we just want to keep things moving. So Assemblywoman Peters.
Thank you, Madam Chair, and thank you for giving me the grace to step in and talk about this very important issue. I just want to thank Senator Spearman for bringing this piece of legislation. I think that it's really an important step in gauging what workforce equity looks like for a variety of scenarios. The bill, in its current amended format, reprint 3, designates UNLV the ability to conduct a study on equity issues that are outlined within the bill. This has to do with women and women of color, and has specifics of important diversity metrics that we'd like to see in our private workspace. I can go deeper if we want to, but that pretty much covers what the bill does.
All right, thank you. So this would be outside of what our normal studies would be. This would be the university actually performing this, so there's no conflict with our possible change of structure on how interim studies will be done. I just think that would be good to have on the record.
Sarah Peters, for the record, that is my interpretation of the bill. I can't speak to the sponsor's intention of the bill, but it is an elective study for UNLV to conduct, which would be outside of our interim committee jurisdictions.
Okay, thank you. That's how I understood it too, but it's always good to have that question on the record. So with that, committee members, are there any questions of Ms. Peters? But don't throw her any curveballs because she is pinch hitting here, so. All right, I don't see any questions, so this is the hearing for SB 67. We're going to go ahead and open it up to the hearing process. I'll go ahead and ask anyone in support to come forward on SB 267. Seeing no one in the room to come in support, do we have anyone on Zoom? Seeing no one on Zoom, is there anyone on the phone line in support?
If you would like to testify in support on Senate Bill 267, please press star 9 now to take your place in the queue. Chair, we have no callers on the line in support.
Thank you very much. Anyone in opposition in the room? Seeing none. Anyone in opposition on Zoom? Seeing none. Anyone in opposition on the phone line?
If you would like to testify in opposition to Senate Bill 267, please press star 9 now to take your place in the queue. Chair, we have no callers on the line in opposition.
Thank you very much. Anyone in neutral in the room? Seeing none. Anyone in neutral on Zoom? Seeing none. Anyone in neutral on the phone line?
If you would like to testify in neutral on Senate Bill 267, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 398. Please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Good evening, Madam Chairwoman and members of the Assembly Ways and Means Committee. My name is Sabra Newby, SABRANEWBY, representing the University of Nevada, Las Vegas. We are neutral on this bill, but generally supportive of the concept, and we look forward to working with Senator Spearman and others on developing the study and certainly trying to gather funding to accomplish such. So we absolutely agree with the outcomes and with the aim for it, and so we are happy to pitch in. Thank you.
All right, thank you very much. Is there anyone else on the phone line in neutral?
Chair, that was our last caller in neutral.
Okay, thank you very much, Ms. Peters. I don't believe there's any closing comments. No. You guys really got to change the rules on that one in the future, let me tell you. So with that, we're going to close the hearing on SB 267. Okay. Right. Thought I heard a blinker. Okay. So with that, give us a moment, committee, and we'll figure out what our next steps are. Is there someone still on the audio line? Thank you. My committee members, we have a list of bills to process, and then we'll probably have to go into recess to allow revenue to get their work done. Let's hold for just a moment. We're making sure we have all the correct documents. So I think we have a comprehensive list, and I think we have all the components in the right place. Hopefully every domino falls over the right way here. So with that, I'll give you sort of a where we are right now with what we plan on moving at this moment in time. SB 27, and I'm just running down the list and then we'll go through each one. SB 27, SB 108, SB 287. Those were heard at previous meetings. And on today's agenda, SB 233, SB 267, SB 356, SB 356, SB 366, and SB 397. That's the list that we're going to work session at this moment in time. I think there's one other bill sort of dangling out there. We're waiting to put all the pieces of that one together. So with that, let's go ahead and we'll go into a work session. And the first bill that we will discuss, committee, will be SB 27.
Thank you, Madam Chair. Senate Bill 27, as amended, authorizes the superintendent of public instruction to investigate certain persons involved with public schools and authorizes the State Board of Education to delegate authority to the Nevada Department of Education to suspend or revoke a teacher's license. Senate Bill 27 makes various changes to the Teach Nevada Scholarship Program, including eliminating the requirement that educational institution participating in the program be located in Nevada, as well as eliminating the requirement that students receive the scholarship agreed to complete the requirements to obtain the endorsement to teach English as a second language or special education. This bill also eliminates the requirement to repay the State Board of Education up to $1,000 of any amount already dispersed to the Teach Nevada Scholarship Program recipients who fail to complete an alternative licensure program in payment of $1,000 to the university, a college, or other providers if a recipient completes the program. In regards to the fiscal impact, as introduced, Washoe County, White Pine County school districts had identified the fiscal impacts. However, both districts have subsequently submitted information indicating that there is no longer a fiscal impact on this measure.
Thank you, committee. Thank you, Ms. Kaufman. So committee, if you'll remember when we were having the hearing, Ms. Miller asked a number of questions about the timeframes that were involved. And we had to go to Mr. Killian and Mr. Fernley to get a couple of clarifications on the NRS and the NAC. Apparently, the 3 years teaching at a Title I school is actually an NAC. And upon further conversation with Mr. Killian, we found out, which was not disclosed at the testimony table, that a regulation had been submitted in October of 2020 to eliminate that 3 years in a Title I school, which I believe gave most of the members in the committee some consternation about that, knowing that we were asking questions about it and not getting we had to go to legal to actually get the answer. I did get a text afterwards clarifying that that was an NAC, but it didn't clarify that there was a proposal to delete that from the NAC. And knowing how strongly the committee feels about that, the chair would propose an amendment to SB 27 that the NAC code that currently addresses teaching in a Title I school be proposed as NRS and be put in statute, therefore it cannot be changed by regulation. Are there any questions or comments from the committee on that proposal? Seeing none, so that would be the amendment that I would propose is, and Ms. Kaufman, if you would cite the NAC so that we have a clear record moving forward.
Madam Chair, the NAC that was cited was 391A.070.
So that would be the NAC that I would like legal to convert into NRS for us and make sure that that provision is protected in the future. Any questions or comments from any committee members at this time? Dr. Titus?
Thank you, Madam Chair, and I agree with you, and I just think that just so the audience knows that, again, in the future, this legislative body can change it if we need to per NRS. So it's not like it's written on stone, it's just written in NRS that would require some thoughtful conversation before it gets changed again.
Thank you very much. Yes, NAC can be changed by an administrator, NRS. You'd have to come into this building and convince a majority of 63 people that you would like a policy change. So the motion would be, was this amended here in this House? I want to make sure I make the correct motion. It was not, Mr. Leiser. So this would be an amend and do pass with the discussed amendment. I'll take a motion from Ms. Monroe Moreno, second from Ms. Benitez Thompson. Any questions or comments on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any in opposition? Hearing no opposition, passes unanimously of the members present. I believe we can go on to SB 108. Go ahead, whenever you're ready, Ms. Kaufman. You need the statement? An amendment? I don't remember a proposed amendment on this bill. I'm sorry? So in order to clarify everything, there was a conversation about an amendment, but with the time constraints, the majority leader is going to do a floor amendment so that we can keep things moving, and we'll just process it that way. So Ms. Kaufman, if you'd like to go ahead and proceed on SB 108, please.
Thank you, Madam Chair. Senate Bill 108 requires that instructions relating to implicit bias and cultural competency be provided to any person who is employed in the juvenile justice system and who has routine contact with juveniles in their work, including employees of regional facilities for treatment and rehabilitation. The impact of trauma and adverse childhood experiences on decision-making and behavior must be included in the training. Regulations governing the implementation of such training must be developed by the Division of Child and Family Services of the Department of Health and Human Services, and responsibilities for providing the training rests with the individual employer. The Nevada Supreme Court is authorized to provide by rule for training for any magistrate, judge, master, or employee of the judicial court who routinely interacts with system-involved juveniles. I would note that there were fiscal notes that were originally provided. However, staff has received confirmation that all the fiscal notes have been sufficed and there is no fiscal impact.
Thank you very much. So with that, committee members, are there any questions on SB 108? Seeing none, then I believe this would be a do pass. So I'd be happy to accept a motion from Ms. Benitez Thompson, a second from Ms. Monroe Moreno. Comments? Hearing none. All those in favor, please signify by saying aye. Any in opposition? Hearing no opposition, passes unanimously of the members present. We're going to go to SB 287, please.
Thank you, Madam Chair. Senate Bill 287, as amended, requires the Director of Agriculture's Extension Department of Agricultural Extension, Department of Public Services Division of the Nevada System of Higher Education to conduct the business and administer all funds of the Agriculture Extension Department. Senate Bill 287, as amended, additionally requires the Director of the Agricultural Experimental Station to conduct the business of the administrator administer all funds that the Agriculture Experiment Station provides. And it appears that the Nevada System of Higher Education removed their fiscal note on this particular bill.
Thank you very much. Are there any questions from the committee members on SB 267? 287. I pulled up the wrong one. They're all starting to look alike. Okay. SB 287. Any other questions? Seeing none, with that, I believe this would be a do pass. There were no proposed amendments. Correct?
Madam Chair, that is correct.
Thank you. So with that, I would accept a motion to do pass from Speaker Frierson, a second from Ms. Monroe Moreno. Any questions or comments on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. And those in opposition? I have a nay from Assemblywoman Tolles. With that, motion carries. Moving on to our next group of bills. I believe our next one to work on would be SB 233, please, Ms. Kaufman.
Thank you, Madam Chair. Senate Bill 233 provides appropriations from the State General Fund of $250,000 in each year of the 2021-23 biennium to the Governor's Office of Finance in the Office of the Governor for allocation to the Nevada Health Service Corp. For the purposes of obtaining match federal money for the purposes of funding certain medical and dental practitioners to practice underserved areas in Nevada. This was presented by Assemblywoman Titus, and there are no proposed amendments.
All right, any questions or comments from any members in the committee at this time? Seeing none, so this would be a do pass. I would accept a motion from Ms. Monroe Moreno, a second from Ms. Benitez Thompson. Any questions or comments on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any in opposition? Hearing no opposition, passes unanimously of the members present. Moving on to SB 267, please.
Thank you, Madam Chair. Senate Bill 267 authorizes the University of Nevada, Las Vegas to conduct a study concerning diversity and equality in the workplace and to conduct a survey to collect data and information concerning diversity and equality in the workplace for certain business entities and state and local government agencies in the state, and revises prospective expirations of an existing survey of businesses conducted by the Secretary of State. There was a fiscal note by the Department of Taxation. However, there was an email submitted indicating the fiscal impact had been removed, and Assemblywoman Peters had presented this bill for Senator Spearman, so there is no fiscal impact and there are no amendments.
Okay, thank you very much, and I thank you again, Assemblywoman, for stepping in on this. So with that, committee members, are there any questions on Senate Bill 267? Not seeing any, this would be a do pass, so I would accept a motion from Ms. Peters, a second from Ms. Howdigy. Any questions or comments on the motion? Seeing none, all those in favor, please signify by saying, I'm sorry? Oh. All those in favor, please signify by saying aye. Aye. Any in opposition? Hearing no opposition, passes unanimously of the members present. I believe our next bill would be SB 356.
Thank you, Madam Chair. Senate Bill 356 366 as amended requires the Department of Corrections and the Division of Child and Family Services, the Department of Health and Human Services, in consultation with the Juvenile Justice Oversight Commission and other stakeholders, to conduct a feasibility study regarding the youthful offenders. The study must include a review of housing youthful offenders, including housing youthful offenders between 18 and 24 years of age convicted as adults, separately from offenders who will not be released before the age of 25. Section 1.5 of this bill, as amended, includes a general fund appropriation to conduct a study of housing youthful offenders required by the bill. And I'm sorry, it was Holly Wellborn and Ross Armstrong provided the presentation on this bill, and there are no recommended amendments.
Okay, so with that, committee members, any questions? Seeing none, I would accept a motion to do pass SB 356 from Ms. Monroe Moreno, second from Ms. Benitez Thompson. Any questions or comments on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any in opposition? Hearing no opposition, passes unanimously of the members present. Moving on to Senate Bill 366.
Thank you, Madam Chair. Senate Bill 366, as amended, authorizes a juvenile court to issue an order to join any governmental entities or other persons as a party to enforce a legal obligation to a child who is subject to an order of certain circumstances. Senate Bill 366 also provides that a child found to be incompetent may not be committed in the custody committed to the custody of correctional facility in certain circumstances. And finally, the bill requires each Department of Juvenile Services and Youth Parole Bureau of the Division of Child and Family Services to submit preceding information regarding the competence of a juvenile, and for the Division of Child and Family Services to review current services being provided relating to the competency of juvenile. With regard to the fiscal impact, the Division of Child and Family Services had identified a fiscal impact of $50,000 to complete a study to determine the specific needs of treatments of youth to assure the proper resources to provide safe and effective care for the youth, to provide safe and effective care for youth as identified, and the division had indicated that federal system of care funds would be used for the cost of the study, and there would be no general fund required for this bill. Bridget Duffy presented this bill on behalf of Senator Orenshaw, and there are no recommended amendments.
Thank you very much. So committee members, are there any questions on SB 366? Not seeing any questions. This would be a due pass. So with that, I would accept a motion from Ms. Monroe Moreno, a second from Ms. Benitez Thompson. Any questions or comments? Seeing none, all those in favor, please signify by saying aye. Aye. Any in opposition? Hearing no opposition, passes unanimously of the members present. Moving on to SB 397.
Thank you, Madam Chair. Senate Bill 397 requires the Division of Child and Family Services of the Department of Health and Human Services to establish the Extended Youth Adult Support Services Program to provide extended youth support services to certain persons between 18 and 21 years of age. This bill was presented by Joanna Jacobs on behalf of Senator Orenshaw, and the fiscal impact does appear to be removed, and there are no amendments.
Right, committee members, are there any questions at this time on SB 397? Seeing none. With that, this would be a due pass. I would accept a motion from Ms. Monroe Moreno, a second from Ms. Benitez Thompson. Any questions or comments? Hearing none. All those in favor, please signify by saying aye. Aye. Any in opposition? Hearing no opposition, passes unanimously of the members present. Give me a second with the majority leader. We're going to hold, we're waiting on an amendment for another bill, and we're going to hold for just a moment. After we take care of that bill, it's my intention to recess. We have to let revenue meet to deal with what revenue needs to do, and then time permitting, workload demand, we will come back in this room a little bit later on, depending upon how things flow on the floor, pitching and catching with the Senate. Okay? So give us a moment to get all the amendments scooped up into one pile. So committee members, we will go ahead and come out of recess. I believe we have one more bill to address with an amendment before we recess to go to the floor, because amendments have got to get down there for us to get them addressed. And then we need to let revenue meet. So with that, Ms. Kaufman, Majority Leader, if you would walk us through where we need to go on this. Did we need Mr. Flores at the table? Yeah. Mr. Flores, if you would come to the presentation table, please. I'll have Ms. Kaufman walk us through it. I'll go to the Majority Leader, and I'll go to you, and then we'll figure it out. Ms. Kaufman.
Thank you, Madam Chair. Senate Bill 347, as amended, creates the Task Force on Sexual Misconduct at Institutions of Higher Education, requires it to review the results of any climate survey on sexual misconduct administered at the institutions, and to hold annual meetings to provide recommendations to the Board of Regents on how to address sexual misconduct. Senate Bill 347 requires the Board of Regents to compile reports from the institution and forward them to the Director of the Department of Human Services and to the Legislature. And finally, Senate Bill 347 allows a student who has experienced sexual misconduct to request a waiver from certain requirements relating to scholarships of academic activities, requires certain information to be confidential. There was a fiscal note that was provided by NSHE, however, that has been removed, and so there appears to be no fiscal impact. And there have been two proposed amendments that have been submitted. Amendment number 3491 and amendment number 3468.
Thank you so much, Madam Chairwoman. So I believe Mr. Flores is here to walk us through Amendment 3491. This was a separate bill that he presented in this committee, and there were pieces of it that needed to be worked on, and by the time we came to kind of good solution on it, it was past the time frame where that assembly bill was going to really clear our time frame hurdles. And so both Senator Scheibel and Assemblywoman Flores have been so kind and generous as to say that certain pieces of that bill could be amended into here. And so Mr. Flores will walk us through that. It does not change the fiscal impact, but as we walk through it, we'll confirm that. And it's obviously a little bit, there's no substantive change. It's just, you know, how we get these things in front of Ways and Means, and we kind of have to tidy up a concept and make them work. So Mr. Flores is going to walk us through that.
Thank you, Madam Chair, esteemed colleagues of the Ways and Means Committee. I am Assemblyman Edgar Flores, and I wanted to present the proposed amendment that you should have a physical copy before you of Amendment 3491. Rather than read the digest to you, just for the sake of clarity and making sure that everything here is tight, I'm just going to walk you through the actual pages of the physical document in front of you, and if you can follow along with me. So first, I'd like to ask that you please go to page 19. And in page 19, you'll see the conversation pertaining to military, children of military, members of the military. Now, we wanted to make sure that we in no way were in conflict with any other legislation that deals with members of the military or their families, and we've had an opportunity to review that through legal, and in fact, we are not in any way altering that. The language that you see specifically here starts in page 19, line 27, but really where the most important portion of it is in page 20, lines 16 and 17. One of the issues that we were having when we talk about in-state tuition for members of the military or their family, the issue we were having is that the way the statute previously read is it said enrolled. And what happens is students often are admitted to, say, UNLV, but then in the process of them having already been admitted, maybe a week later, their family members were stationed elsewhere, or they were stationed somewhere else, and they would no longer get that the in-state tuition. And so the issue that we addressed here, and then she said that they always meant for every student who's already been admitted to be covered under in-state tuition, but it was just oversight in the way it was written, so they just wanted to put that clarifying language in there. So the moment you're admitted, you're now eligible for that in-state tuition. But that's always been their practice. The issue was just the way the statute was written. And we had an opportunity to review that. Next, in page 21, again, it's going to the same. We're having the same exact type of conversation regarding who's getting in-state tuition. Students who have graduated from a high school located in the state, regardless of whether or not the student or family students have been bona fide residents of the state for at least 12 months. This goes to students who, at times, we've had issues who perhaps are in the process of adjusting status or fixing their immigration status. If they graduate from a high school in the state of Nevada, they're going to be eligible for that in-state tuition, and that's what this is addressing there. I just wanted to make sure that was abundantly clear. And then in page 24, at the very bottom of page 24, you'll see some strikeout language. For those individuals who apply for the Millennium Scholarship, presently there's a requirement that you fill out an affidavit saying that you're a U.S. citizen, legal permanent resident, or that you're in the process of becoming a citizen or legal permanent resident, or that you'll become one as soon as practical. It served no real purpose with the Millennium. It wasn't helping us in any way. So we're simply striking out that language. And more importantly, for students who are in the process of adjusting their status or going through that process so that it becomes a lot less intimidating. But again, we're just removing that language. Then next in page 28 is the next portion where we address in-state tuition. And you'll see in line 19 of page 28, it says section NRS 3965 is hereby amended, 396.952 is hereby amended to read as follows. And then if you go down to lines 39, 40, it says be a bona fide resident of the state of Nevada or have graduated from high school located in the state. And then in lines 43 and 44, it refers to an exception. But again, this is just talking about promise for those who are eligible. We're talking about individuals who have graduated from a high school here in the state of Nevada, and I make that point only to make it clear that before, when we talked about these different, so promise and college savings accounts, when we talked about those two different things, there was a question as to whether or not certain students who are in the process of adjusting status or undocumented or Dreamers DACA were eligible for that. So we were trying to address that particular section and making it clear that a student who graduates from an institution here is eligible, and that status would not somehow keep them out of that. Just wanted to make that clear. And then page 29. And excuse me, if I could clarify, I actually jumped ahead of myself. The section here reads specifically for the Silver State Opportunity Grant. So in page 29, sub 6, line 5, previously, if you recall when I presented this bill, Assembly Bill 213, up to 5% of the money could be used for administering the Silver State Opportunity Grant. And what we're doing here is removing that language in its entirety from the original bill. And then through this amendment, we're saying that to the extent that the money is available for administering the alternative application. And the reason that we need an alternative application for those that want to apply for the Silver State Opportunity Grant is there's usually a requirement that you fill the FAFSA. But you can't do that if you don't have status, immigration status. So you needed to create an alternative framework. So the way we wrote this is to say if there is money, to the extent that money is available, so it is permissive language, they could make that, the SSOG, available to all students. And I'll read it out loud just for the sake of clarity and to make sure that we're all on the same page, because we want to make sure that we are not in any way going against what we committed to doing here. So it reads, to the extent money is available, the Board of Regents may prescribe an alternative determination for financial aid for a student who is prohibited by law from completing the free application for federal student aid provided for by 20 U.S.C. Section 1090 pursuant to paragraph E of subsection 4. If the Board of Regents prescribes an alternative determination for financial aid, a student who is prohibited by law from completing the free application for federal student aid shall complete the alternative determination for each semester of participation in the program on or before the deadline prescribed by the Board of Regents. So again, making it abundantly clear, to the extent that money is available, they can do that, but it's not a requirement. And then on page 30, lines 1 through 5, at the very top, you'll see that it reads, federal student aid, or if the student is prohibited by law from completing the free application for federal student aid and Board of Regents prescribed an alternative determination for financial aid pursuant to subsection 6, NRS 396-952, the alternative determination for financial aid prescribed by the Board of Regents submitted by the student. So again, we're just reemphasizing that this is permissive language. Nothing here is a shall, and she is not required to do anything. And then, like I said, I was speaking out of turn. Again, we're putting the same terminology for the SSOG. We're putting that in page 30. We're talking about promise. And this is where we're saying if you have graduated from a high school in the state of Nevada. And again, by saying just having graduated from a high school in the state of Nevada is the equivalent of us making it clear that whether you're a student out of status or in the process of adjusting status or DACA, whatever it may be, as long as you've graduated, that you're now going to be eligible for this. So that's why we're putting that language in there, that we're not somehow differentiating between immigration status. And then lastly, on page, trying to see what page it was here. Lastly, on page 36, lines 17 through 22, this is just the language saying that college savings account programs will not be denied to a student simply because of their status. Now, whether or not there's other reasons why it can't be done, that's fair, but this is just saying if there's other requirements and they can't meet them, then that's fine. But simply the mere fact that someone does not have status or is in the process of adjusting status or has DACA or anything like that, that's not going to be a reason for someone not to have access for the college savings account. And with that, Madam Chair, if there's any additional questions or anything we need to additionally clarify, I would gladly do so at this time.
Okay, so thank you. With that, I do have just one question, and I want to make sure that that I'm understanding you correctly. So the original proposal in 213 would have allowed NCHI to take a 5% cut off the top. So what you're saying now is that section has been totally deleted, and as money is available, they can come up with the alternative process.
That's correct.
So not as money is available, they can get 5%, but as money is available, they can come up with the alternative process.
Thank you
Correct?
for that question, Madam Chair. Assemblyman Edgar Flores, for the record, absolutely.
Okay.
That request at first of up to 5% is off the table. They can't do that.
Okay. And we just don't want to open a door for people taking an indirect cut off the top of a scholarship. I think that would be a slippery slope in the future that you wouldn't be able to walk back. So, committee members, other questions of Mr. Flores on these particular items? And Mr. Flores, you have discussed this with Senator Scheibel and Assemblywoman Torres, and they're fine with you amending their bill at 7:30 on Sine Die night.
Thank you for that question, Madam Chair. Assemblyman Edgar Flores, for the record. And again, I because I know we're so busy, I try to not dive too deep into the thank yous, but that's correct. They were incredibly helpful, and there's a lot of students that are
All right.
very thankful to them.
Okay, that sounds good. Committee members, any questions? Seeing none, Majority Leader, how would you like to proceed?
The Second Amendment was one that was presented and discussed by the two bill sponsors at the hearing, so I believe that we discussed that one, so I think it would be the committee's pleasure, if you would be willing to accept a motion, Madam Chair, I would move that we would adopt both amendments to the bill.
So the motion from the Majority Leader would be to adopt Amendment 3468 to Senate Bill 347 and adopt Amendment 3491 to Senate Bill number 347.
Correct, yes, Madam Chair.
Are there any questions or comments from them? Oh, I have a motion from Majority Leader.
So moved.
Second from Ms. Miller. Any questions or comments on the motion? Not seeing any. All those in favor, please signify by saying aye. Aye. And any in opposition? Hearing no opposition, passes unanimously of the members present. We'll report this out as soon as possible to make sure that the amendment can catch up with us. So with that, we will stick with our original plan. Revenue does need to meet, so I'll go, I think we can go in recess for just a moment. And if I could ask the Assembly Ways and Means Democrats to meet me in my conference room very quickly. There's one more thing we need to go over, so with that, we are in recess.